What we're interested in is what are the late side effects of breast cancer treatment. Now that we see that we cure so many people, so we need to make sure they have a good quality of life afterwards as well. And one of the risks that patients are facing is if you give radiotherapy to the chest wall, the heart is mostly in the field of the radiotherapy. And what are the late-term side effects of that? Do we have an increased risk of coronary heart disease, of heart failure, of valvular disease? So what we did is based on the Netherlands Cancer Registry, which includes almost all breast cancer patients treated in the Netherlands. We linked the patients, which we have clinical information, with several other databases, mostly cardiac databases, to see whether they had cardiac events. And on top of that, we sent letters to their GPs to ask whether any cardiac events had happened. And that way we could show that having radiotherapy to the heart, at least to the chest wall with the heart being in the field, increases your risk for cardiovascular disease. And that should be something, once we can be able to validate these results, that you should take into account when discussing risks with your patient. Not just the breast cancer recurrence risks, but also the risk of valvular heart disease or cardiac disease in general. And maybe also to have other healthcare professionals, not just oncologists, be aware of the fact that once patients had this radiotherapy, it may also pose a risk to other organs, so the heart. So risk factor management may be very important for these patients.